Alrighty, y'all. Hello. Talking about healthcare today. I'm going to learn a lot, at least I hope to. It's the healthcare system of France. Now, of course, healthcare in Europe as a whole, we tend to say is just more affordable and, most of the time better than here in the U.S. It is one of the biggest talking points when comparing, the U.S. versus any other country. You can have great healthcare here, but for the most part, it's pretty scary, actually. It can be very lackluster, and more importantly, it can literally bankrupt you. It's just very expensive. And I want to get into learning more specifically about different healthcares and different kind of government services from different countries to give me that kind of perspective, right? I think it's very important and very refreshing to see how other countries do things. This is from Healthcare Triage. And as far as I know, I've heard France's healthcare is really, really good. And I've heard, of course, it's a lot more affordable for the average person than here in the U.S. So let's go ahead and take a look. This will be linked down below so you can watch
There's a saying
their
I'm quite
channel.
fond of, although I'm not sure who first penned it. The French love their healthcare system and change it all the time. Here in America, we hate ours, but refuse to touch it. There's some truth to that. There's also a lot that much of the world could learn from France. Their healthcare system is the topic of this week's Healthcare Triage.
Yeah, he's right. So many people, especially compared to like when I was little, like still people always complain about healthcare here, but as I've gotten older, I've noticed more and more people, I think also with social media and people spreading word, goes faster. Like people really are kind of, waking up and realizing how corrupt and expensive and kind of ridiculous or broken our healthcare is here in the U.S. Some would say not broken. Some would say it's working exactly by design. It makes a lot of corporations and pharmaceutical companies rich. The average person struggles in life, and healthcare is one of the reasons why. But nothing's done about it. I don't know. It's
Toward the end of World War II,
weird.
The French realized that their country was in pretty bad shape. There was little chance that the shattered private sector was going to be able to take care of all the people who might need healthcare in the next few years. So France established a system of national health insurance in 1945. Their system is, ironically, for those of us in the United States, known as Social Security. Everyone in France must pay for mandatory health insurance. Insurance is obtained from nonprofit funds. There really isn't any competition, and there really aren't many choices. There are 5, known as general, independent, agricultural, student, and public service. One fund alone covers almost 85% of all people in France. I'll give you 3 guesses which one it is. They all have pretty much the same benefits and the same reimbursement. The only people who don't fall into one of these 5 funds are people who've never worked or aren't covered by other sources. For those people, the government has its own plan, financed by taxes, that reimburses better than the other funds for people like the very poor who can't make out-of-pocket payments. These funds are financed largely by the public. More than 40% of healthcare.
Wow, see, that's what's so cool about this. I thought he was going to say for those, the way he started that, for those people that haven't worked and people very low income, like maybe they're get left behind, like there is no plan. No, there is a plan. There's a plan for everyone. That's pretty cool. Take a look at the pie chart. Of course, payroll taxes, income taxes, also a good amount from tobacco and alcohol taxes. That makes sense, right? Anything that would be detriment to your health, might as well make revenue off of that to incentivize people being healthier, right? This probably adds up because a lot of people smoke, and I mean alcohol. People drink alcohol everywhere, but I think a lot of people in France smoke compared to here in the U.S. Seeing the word Social Security too, it's just funny because that's something that they keep saying in this country here in the U.S. that people my age, by the time we can even touch that, when I'm 65 or whatever, there's gonna be nothing left. So I have that to look forward to, and anytime I get hurt or sick, gotta worry here in the U.S., right?
Spending is financed by payroll taxes and about a third from income taxes. The rest comes from tobacco and alcohol taxes, some transfers from other branches of Social Security, and a small amount from state subsidies. Altogether, this covers more than 3/4 of all healthcare spending. This insurance covers a lot. Inpatient and outpatient care, specialists, dentists, midwives, diagnostic tests and services, prescription drugs, medical
midwives, dentistry, everything.
Devices, mental health, even health-related transportation.
Mental health, that's severely lacking, or care for that is severely lacking here.
Stuff we'd never consider covering in the United States is included. Things like homeopathy, house calls, amazing maternity benefits, and even childcare. Social Security.
Wow. He said the transportation. Everyone jokes about how expensive ambulance rides are here. It's true. A couple $1,000s usually. Childcare, what's that? You have to pay a lot of money for that. That's not covered here. Geez, what else? This is like incredible. It's so much. It covers so much. I can't even keep up.
Things like homeopathy, house calls, amazing maternity benefits, and even childcare. Social Security.
Maternity benefits are obviously better. More time off, too. Oh, my goodness. You know, it's not even bad hearing this. It's just eye-opening. I'm like happy. I'm happy for you guys. I'm happy that other places experience this. This is what it should be. I'm just mind blown. I'm just mind blown that a country like the U.S. doesn't do this. It's one of those things you never knew as a kid and you grow up and you're like, man, that sucks. Why am I in a place where we don't do it like this, right?
Security covers somewhere between 70 and 80% of costs, leaving the remaining amount in individuals' hands. But there's also voluntary health insurance provided by private insurance companies or from the government for those who are poor.
I like that you have choices.
This insurance covers many of the costs that Social Security doesn't. More than 90% of the French have voluntary health insurance plans, mostly through their jobs. Almost 70%.
Oh, so you have that safety net no matter what. No matter who you are, no matter how rich or poor, you have that safety net. That's amazing, right? And that's the winning plan. That's like the overall awesome positive for everyone. Then you also have voluntary or private healthcare plans or options. And he said 90% of French people actually have that as well. And that's pretty cool. And I'm sure it helps with some things compared to the like totally public plan. I bet it's much more affordable still as well, right? Because here, you know, I pay taxes and part of my taxes supposedly goes to healthcare, but I don't get to access it though, right? Because I don't meet the right criteria. And then, you know, I have to pay a lot of money for insurance. And then, you know, you've heard me say this before. Then I have to pay for stuff still. Nothing's ever like covered the right way. It's a mess. And so that cost of like private healthcare that I'm basically forced to have is very, very expensive, right? We're talking 4 figures a month. So that means over $1,000 a month. It's over that. And then there's deductibles I have to pay. And there's copays. And yeah, I won't bore you with the rest. It's not fun. I guarantee that cost is much less in France.
Of primary care physicians, and more than half of specialists are self-employed. Again, France is not socialized medicine. About 2/3 of hospital beds are owned by public or nonprofit groups. The other third are owned by individuals or corporations and are totally for-profit businesses. Doctors make much less than those in some countries, maybe 1/3 of what doctors do in the United States.
It's funny because all this is like not what you hear here, right? Everyone here acts like everyone else has totally socialized healthcare, and they always talk negatives about it. It's just so funny. It's very weird.
But they get medical school for free, and they pay nothing for malpractice insurance.
Wow.
And if they agree to charge government-approved rates, they get some of their Social Security taxes waived too. So it's not as much of a difference as it first appears.
So doctors make 1/3 less, which that could be a gray area. I'm sure that varies. But you hear that as an American, you're like, whoa. See, like I'm not advocating for the American side because I think ours is completely broken. But I'm saying someone that would be like, see, our doctors make way more than theirs. Their doctors make 1/3 of what we make, but they don't have any costs to get there to become a doctor, right? The schooling, the unbelievable schooling it takes. They don't have that cost. They don't have to worry about malpractice insurance. These things cost an arm and a leg here in the U.S. As a matter of fact, I want to look that up before we move on. Cost to become a doctor in the U.S. Look at this crazy cost, by the way, and this can probably go up. This says $235,000 to $280,000 US dollars. That's insane. $250,000. It actually says, including undergraduate costs, the total average is closer to $371,000 to over $418,000 US dollars to become a doctor, guys. Before you make your first penny. For the class of 2030. Living expenses, books, other fees beyond tuition, you get it. It all adds up to a crazy price. Public medical schools, obviously a little cheaper, still almost $300,000. Go private, you're probably going to be looking towards $400,000. So an insane cost, insane, that you don't have, in this case, in France, of malpractice insurance for doctors. This big ranges, but 1,000 to over 100,000 per year. So we don't really know, but thousands, safe to say. So another big expense that adds up. So you see my point. Again, the American that doesn't think outside the borders would say, yeah, see, their doctors don't make as much. our doctors might make some good money after a while, but look what they had to do to get there, and look how much debt they're going to be in. Look at the cost of malpractice insurance, right? They have to have that because if they get sued, that's all over, right? There's just so many worries and stresses, I feel like, on the American way of doing
Funds
things.
and budgets are set by the Ministry of Health, which also regulates the number of hospital beds, what equipment is purchased, and how many medical students are trained. The ministry also sets the prices for procedures and drugs and defines priority areas for future focus and spending. It oversees agreements between Social Security and unions, which represent physicians. Doctors can choose to work outside of these agreements, though, and charge more. Patients have total choice of where they go for care and who they see.
It's cool.
Because prices and reimbursement are set at a high level, they can go pretty much anywhere. There is some level.
See, it still gives doctors freedom to operate kind of how they want, it seems like. They get guidelines and they can follow them in different ways. It sounds like patients still have freedom to visit different doctors, go to different clinics, right? Like, none of this sounds bad at all. And of course, it all sounds different to what you would hear over here in the U.S. A lot of propaganda showing us how other countries don't have it good. We do. But it's funny how when you actually find out what it's like, it goes against that.
And charge more. Patients have total choice of where they go for care and who they see. Because prices and reimbursement are set at a high level, they can go pretty much anywhere. There is some level of gatekeeping.
Not here, by the way.
Pay less if they get referrals to specialists.
You pay if you go out of network.
Those referrals aren't to specific facilities or physicians. They're just permission to choose what they want. Most people in France pay very little themselves for their health care.
That's amazing.
After insurance kicks in, doctor visits can cost €1 or less. A hospital stay can run as little as €18 a day, mostly for the room and board. Prescription drugs are like €0.50. All of these together are capped at €50 a year. An interesting aspect of the system is that copays are regulated by sickness. People who have chronic conditions have all their copays waived. In other words, people who use the most care in general pay the least. France also allows pretty impressive access. For instance, it guarantees that cancer patients can get any drug they want, even expensive or experimental ones. As I said in the
that's incredible. Even with dire circumstances, you get crazy disease, you get the C word, right? That's scary, right? You get access to any treatment imaginable, even experimental stuff. Hearing this is just amazing. Like it blows my American mind. It's just, these are things that would, you would die of the stress. You know what I mean? Over here. It's
beginning of this episode, the French love their system. In international surveys, it always kicks butt in terms of satisfaction. It also crushes the competition in terms of quality. In almost every international comparison, no matter what methodology you use, France comes out near the top, if not in first place. I've never met and rarely read anyone who has a bad story to tell about their care there. The knock against the French system is that it's expensive.
You can find bad stories here.
It's $4,118 per person, is well above the OECD average of $3,322 in 2011. But it's nothing compared to the $8,508 we spend in the United States. With respect to spending as a percentage of GDP.
And you get his point. These numbers are old. We're looking at like 12, 13-year-old numbers here, by the way, but it's not like it's gotten any cheaper here in the U.S.
GDP, France is near the highest in the world at 11.6%. That's beaten only by the Netherlands at 11.9%, and of course the United States at 17.7%. So everyone else in the world may have a genuine case when they claim that France is too expensive. But I laugh at anyone in the United States that says so. Genuinely.
Thank you.
Universal coverage, comprehensive benefits, complete freedom of choice of providers, top in the world outcomes. There's a good case to be made that the French have the best healthcare system in the world.
Wow. Very well done. Use the link down below. Check out their stuff. Holy smokes. First of all, round of applause. Bravo to France. That is impressive. That sounds awesome. That sounds really cool. It's cool to see a little bit, and this is a short video, but like it's good to get a pretty, basic idea of how it works, how it's funded, how people are taken care of, what choices and freedoms they have within it. It's very cool. Very cool to see. And as expected, it sounds pretty damn nice. Wow. I can do nothing but laugh at ours, right? you know what I'm saying? It's very cool to see. I think one of the biggest things that's funny, regardless of all the pie charts, the numbers, the wages, the costs, all these things, it was the comment he made. You won't see many, if any, stories of people complaining through the roof and stressed out beyond belief about French healthcare. But you will find, just millions of examples of that about American healthcare. So I think that's way more telling than it appears to be, in my opinion. I love these comments, by the way. People say that if Breaking Bad took place in France, Walter White would have handed his carte vitale and end of story. So I'm probably missing. This just has to do with French healthcare, obviously, and basically saying, yeah, there wouldn't have been a big, plot that was in Breaking Bad of him trying to pay for his care to save his life. It would have been, let's just say a lot quicker and easier, and a lot, less of a crazy show if it took place in France. As a French person, I can say that I truly appreciate that anyone, even foreigners, can walk into a hospital and be taken care of regardless of their financial or social situation. No one will ask you if you can afford a test or procedure before helping you. Because if you can't afford something, the government will help you pay. Most hospitals will make payment plans to help if it's necessary. We have amazing payments. Also, as a woman, I can get the pill nearly for free for my entire life. I understand daily contraception is expensive in certain countries. We are truly blessed on this topic, but don't get me wrong, we're French, so we'll still find ways to complain about it, of course. I mean, there you go. Very interesting and, educational for me. And, something to hope for, although what are the chances of something like this actually happening in the U.S. anytime soon? I'd say less than 1%, sadly, but who knows? Hopefully, I would love to be wrong on this. I would love to hear your experiences and comments down below. And I hope you found this fun and enjoyable. I really do appreciate you watching. And hopefully I'll see you in the next one. I have a lot of learning to do. My name is Ian. You're watching IWrocker. Until next time, y'all. Catch you later.